Okay, everybody, let's get started. Welcome to the Secret to Patient and Client Loyalty. It's the second in the fall series for TAG webinars this season. My name is Eric Crump. A lot of you have met me, know me. Eric stands for Every Referral is Critical, by the way. That's the way to remember that. You can always contact me directly here at TAG. Our number is 1-866-232-6477, or schedule a home care coaching call. If they come off the webinars, I usually take those myself, and you can get to all the post-webinar reruns on www.youtube.com/TAG webinars. We are TAG Home Care Marketing, and honest to goodness, guys, we're underappreciated. It takes a lot to be a full-service marketing team. I hope everyone gets an opportunity at one point to come to Franklin, Tennessee and attend one of our boot camps, or just come for a visit. We're very proud of the TAG team. It's a lot of creative people, hardworking people. It takes a lot to do soup to nuts in marketing. You have to do print, collateral, be able to do website development, strategy, consulting, CRM development. We have a host of really talented people, and we'd love for you guys to meet the entire TAG team. Adam and I are usually anymore the face of the team, but if you know us and if you've been here to Franklin, you know it's a team effort, and there's a lot of great creative people here. We do have an open boot camp on December 1st and 2nd. Didn't talk to Reba right before I got on air, but I think there's still 2 seats left. That would be a day and a half here in Franklin, Tennessee, of some really great training. I want to show you the top 2 sellers this year of collateral pieces. Everybody asks on webinars of all your products and strategies what works the best. And I'll tell you, the top seller this year is our guidelines for home health admission. It's a great little flip chart that you can give to your clinical referral sources, especially physicians like them. Physicians think DRGs, disease-related groups, and when they write home health orders, if they get one ICD-9 code right, they're doing themselves a service. So what this is that it gives them a cheat sheet on all 10 major headers of ICD-9 codes and the most common home health diagnosis associated with those codes. It also gives your sales reps really good tips on how to upsell to certain diagnosis. Number 1 seller for us. Number 2, of course, this year was big item was face-to-face, and we have the Physician's Guide to Face-to-Face cards. So it's not as hot now as it was in the spring, but still, if you need to educate your physicians on exactly why you're bugging them 2-3 weeks post them signing the 485, they'll understand it. Today, I want to talk to you about the best return on investment you can make as a home care agency. Now, we concentrate a lot of our efforts on your number 1 money drain, and that is your sales staff, your human collateral, we'll call it. And we try to make these sales reps the most productive sales reps they can be, because they're your biggest drain. They're your biggest overhead expense in sales and marketing. So apart from that, the best return on investment you can make outside of your training your sales staff, and trust me, you call me and I'll tell you what's wrong with 9 out of 10 sales reps. I don't pull any punches. But the biggest passive return on investment you can make for your agency has got to be a loyalty program. A marketing dollar spent in client retention is said to have 10 or 15 times the effectiveness as one spent going after new business. Everybody understands that and believes it, but nobody does anything about it. They'll call into the home and ask about services, but this is a branding exercise, and we're going to talk about that and why it's so important. I really believe there's only 2 ways to get business in today's home health market. That is, you have to retain satisfied customers because they're coming back, and these Medicare numbers are like gold. to agencies anymore. And you have to show them a better patient care model and be able to give them a reason to change who they're using now is on the other side of the coin. In other words, there is no new business. Referral sources in home health recognize that home health can benefit some of their patients. They're just creatures of habit. And if you're not giving them a reason to change who they're using now, they're not going to give you new business. So that's two sides of the coin. We're going to address one of them today. One of them today is we do a really poor job of branding our services with our satisfied customers. Now, today's webinar is going to be targeted toward skilled nursing and therapy services. Although, I want to get this point across to you, there's a lot of branding and customer loyalty to be done in both private duty and hospice services as well. With private duty, it's all about putting your footprint into that family dynamic and making them satisfied, being the Nordstroms of private duty care in your local community. I was recently in Houston, and I want to give a shout out to the Texas Association of Healthcare. That group is a pretty good group down there. They were hosting our meeting at the huge mall there and the Galleria, and they were giving away coupons to Macy's. There were more Nordstrom bags than Macy's, and Nordstrom's didn't have a sale going on. But it's the name recognition, the quality aspect. People were proud that they bought their items from Nordstrom, even though Macy's had a huge sale going on. I bring up that analogy to tell you that's what you need to do as a home care agency or a private duty agency or a hospice agency. You don't need to be the cheapest. You need to be the best and brand yourself that way. $1 spent in marketing, usually on average, even if you just didn't turn the lights on and shot in the dark, is going to bring $5 in actual business. So keep that in mind today when we go through the webinar. Private duty, it's a separate discussion. You do need to have newsletter program. You do need to make a constant effort to brand yourself in your local service community. Hospice, man, there's some great things you can do to brand hospice services. You need to make advocates of these palliative care families. Don't just look at the patient themselves. Consider all the extraneous family members and brand yourself with those family members. There's some great ways to do that. It's not going to be the focus of today's webinar, but give me a call and make a coaching call. I'd be glad to share some of the ideas that are working with hospice agencies. So consider these customer stats that you guys have been staring at while I've been on a rant. Acquiring new customers costs 5 times more than satisfying and retaining current customers. 2% increase in customer retention has the same effect on profit as cutting costs by 10%. That's amazing, right? If you can attract 2 out of your Medicare patients back on service, that's the equivalent of 1 of your overhead staff's salary every year. A 5% reduction in customer defection rate can increase profits by 25 to 125%, depending on the industry. And in home care, it's such a specific patient model that we're after, and we have to have signed orders to start a plan of care, that it's even greater. They're very valuable, and we're going to go over some strategy and exercise in a minute on how to track that efficiently. The customer profitability rate tends to increase over the life of a retained customer. In other words, once they're on service and they keep coming back to you and they keep satisfied, you keep them satisfied, your profitability goes up and up and up because it doesn't take as much of your overhead dollars to attract them in. So we're going to talk about Medicare patients, direct Medicare patients. The average Medicare patient comes back into an acute setting or a series of chronic condition settings to where they need home care services 4.5 times. Once they come on service one time, the average initial home care patient comes on service 4.5 times. So my question is to you, are you capturing those other 3.5 times on average? And we all know that some of them are a lot more than that, right? How many clients remember your agency at the point of an acute discharge? Nationally, and remember we're a marketing firm, and we put out questionnaires to referral sources and clients all the time. Nationally, 19% can name the agency that took care of them on the previous episode. 81% cannot remember your agency's name, to the point of forcing the referral sources in the hospital or the discharge planners in the hospital to honor patient preference. Isn't that amazing? 4 out of 5 are walking out the door. They love Nurse Betty or Ronnie the therapist, but that's all they remember. They remember the therapist or the nurse's name. They forgot your agency's name. You didn't do a great job of branding the agency. Your nurses aren't saying it on every visit. You're not leaving cards in the home. You're not touching them with collateral throughout the year to keep top of mind. You're not giving them branding benefits that they carry around in their wallet. So we need to do a greater job, because you're putting 81% of your client base at risk. So it's like a present that you're giving to your competition. Here they are. Here they're back out into the general population pool. Go after them with all your tricks of the trade that get you new business, because now our discharge patient is new business. If we didn't do a good job and brand ourselves with that discharge patient, they're the competitors down the street's new admission, right? So you're leaving your satisfied customers to chance is risky strategy. So we have 5 models here. You are just a quarter. 20%, 1 in 5, right? A fifth of the possibilities, if you just leave it to choice, they'll come back to you, as opposed to patient choice being verbalized at the point of an acute discharge. Regulations say they're going to be your patient, right? So here's the first thing I want to do. I want to teach an exercise to you guys as part of a strategy that you should put into operations. This is going to be worth coming to the webinar today. Just learn this exercise, and that is, go back to the Medicare Common Working File and run your discharge patients' numbers again. You do that on quarterly time frames, and you track your retention rate. You track how many of your clients come back to you versus go on service with another home care agency. Because when you have those Medicare Common Working File access, and you have the patient's payer number, Medicare payer number, you've got all you need to do this exercise. It's worth it to see how much you're retaining. To be a healthy agency, you need to retain about 85 to 90% of your clients. If you do that, then you're constantly in a growth mode. If you don't do that, then you're constantly going after new clients. You're in dangerous waters, because everyone's building a fence around their patient populations. Hospital home health, the major players, the publicly traded home health, they got more money to pour into attracting new business than you do on average, or they have more access. They can deny access to you. You know the reasons why you need to have a great loyalty program. What I'm telling you is to make a conscious effort to track what your retention rate is. If you go to Medicare Common Working File with a known payer number and they've gone on service with someone else, you've lost that client, and usually you've lost them forever. Not many return on the 3rd episode because you don't have access anymore. You did a great job getting them, and now you just lost them the second go-round because you didn't have an aggressive branding operation, right? So we have a loyalty program that's pennies on the dollar, because, and that's most of our products. If you were to spend the time to develop them, come up with them, and even take them to a local printer, you're going to spend 3 to 5 times more than we can do it for you, because we have already developed these things. All home health, skilled nursing, and therapy services are local. Therefore, we can duplicate services in every major market across the country. It's already built for you. We just need to tweak it to tell your story. That's what the Health Matters loyalty program is all about. It's the most effective return on investment piece of collateral that we sell, and we never sell enough of it. We preach this everywhere we go, and for whatever reason, home care agencies just don't get it. They don't realize the value of bringing on those discharged patients back to their agency. And even if they do, they just throw some token exercise with it. Like we have a discharge nurse call them 6 weeks out to remind them that we're still out here or whatever. No one keeps top of mind with that, right? I have 4 children. I can't remember all 4 of them's names half the time. I sure as heck can't remember an agency's name because they called me 6 weeks after I was discharged and think that they branded their agency name to me. You have to have constant contact. So, direct-to-consumer model. You need to bring them into your family. Make them advocates of your agency. Make them an active part. You come up with discharged patients and have a steering committee of discharged patients giving you advice. And what you do, you make advocates, and they're like little marketers out there in the community for you. Here's what home health can do. You know, they'll educate their friends and family members about home health services. And when you empower them and value their opinion, they're never going to leave you. So that's what we're trying to do. Finding your target audience and how the Health Matters Loyalty Program reaches out to prospects. We'll talk about that, and how Health Matters Loyalty Program equals increased referrals. So the first thing I want to talk to you about in specifics is direct-to-consumer marketing models. Why does that work? Instead of competing with other agencies for the same referral sources, developing a direct relationship with patients and prospects who choose your agency. Here's the simple fact. Most home health agencies depend on blowing up referral sources day in and day out to convince them to give them new patients, right? Not enough home health agencies concentrate on the patients that they already have and understand that they're probably in the wheelhouse of being another discharge within 3 months to 6 months out. In other words, we spend too much time, money, effort in going after new business when we should solidify the customers that we have, because we have their contact information, we have a shot at them. We're doing a great job. I can't say enough about the clinicians and therapists and aides that I meet every time we go out and meet specific home health agencies. We're doing a great job on the clinical side. It's just that we're not marketing ourselves effectively. We're not sophisticated enough to understand we need to be the Nordstroms of our specific home health market. So you go direct to consumer because it works. And how do we know it works? Because pharmaceutical companies used to do what we do, right? They used to call on doctors and clinics and drop off those free meds, and a lot of pharma reps that used to be in pharmaceuticals and thought that they had all this access to the docs because of their personality and their smile, found out that it was really about those free medications they were passing out. And it's a lot harder to get their attention in home health, right? Amen to that one. So we triple direct-to-consumer spending in pharmaceuticals over the last year, and what happens? Oh, the rewards are, in 1999, the average senior 65 and older were on 7 medications. And now the average senior is on 12 and a half medications. And the biggest swayer of choice is the patient themselves. In other words, they saw this Boniva commercial with Sally Field, right? And all of a sudden they need Boniva. Or they need Ascar or Wellbutrin or whatever commercial they saw. So that's how effective it is. And the next level of loyalty programs is that we're all members of loyalty programs. Here's some that I'm a member of Southwest. I came in last night from Houston on Southwest. I got a story about this lady who was dressed like she was going to camp out. She had a backpack, fanny pack, carry-on, blanket, a water jug, book, an extra reading light, and all sitting in the middle aisle seat, or the middle seat between me. But I fly Southwest anyway because Rapid Rewards. Because about once a quarter or twice a year, I get free flights for myself and the family. Hilton Honors, same way. We give those free flights. I usually team up with my reward program with Hilton Honors. But their message is not if you'll use our services, but you have an option of all. So let me give you the one thing that'll push you over the edge, right? Branding ourselves. So we're associated with certain companies through their loyalty programs. Your home care agency should be like that. Not if you need home care services, but rather what's your choice of home care services in your local service community. That's what you need to put out to your patients that you have on service and past patients. So what you do is you bring in a loyalty program, and if you've been to our live presentations or on coaching calls with me, I love to make lists. So here's your list of the day. There's 3 basic target audience databases that you need to concentrate on. The first one is your past census. That's people that you had on service that are now off their primary or research episodes, and now they're back out in the public population. Your current census, you need to brand a loyalty program with your current census. And then patient prospects, those people that are high risk that you can get to and identify through your marketing efforts, out doing event planning, or through your partner referral sectors. You want to reach out to those areas and find really good prospects and bring them into your loyalty program as well, right? So think about it in the Southwest type thing. Southwest reaches out to people who've flown Southwest and they have the information, but you're not part of their loyalty program. They send you loyalty packets with special offers, right? If you're a current client, they reach out to current clients through emails, mailers, special benefits. You get certain things at a discount. They offer you cheaper flights first, that type of thing. With prospects, have you ever flown Southwest and you see all these booths set up? Now, you'll be down at the wing, say at Hobby or right here at B&A in Nashville, and there'll be no other gates than Southwest. They totally own the whole side of that airport. However, you're going to see 1 or 2 kiosks with them trying to hand out T-shirts or some type of giveaway of plush animal or whatever to get you sign up for the credit card, because that's the next level of loyalty. You take your current flyers and you brand yourself even further with them by adding even more benefits. So that's how they do it. That's how you need to do it, through Health Matters loyalty program or something similar. And remember, we can do this pennies on the dollar, what it'll cost you to do it. But go out and do it yourself, because it needs to be done. Because still, your return on investment is going to be astronomical versus going after new business with brownies and muffins and doctor's lunches and things like that. So your membership package would be a card or a letter telling them about your loyalty program, and now they're a member of it, and you're going to add benefit. You're going to get a flyer explaining home health services so that they're up to speed, frequently asked question, flyer, and a health logbook. And what you'll see as part of those card and letter introduction is a loyalty card that's actually, with the Health Matters loyalty program, it's a coupon card. It gets a discount at drugstores, any pharmaceutical supply house, some DMEs. So Walgreens, Walmart, Target, CVS, they all take this discount card, and it's anything from 5% to 25% off of certain over-the-counter drugs and other items that the seniors will buy. Seniors love coupons, so they're going to keep this, and it's going to be branded with your agency's logo and contact information. Very, very effective. And then you want to send them a once-a-year mailing on their birthday and or holiday. That's your choice. But you want them to know that you remember. Sometimes the average senior 72 and above only gets one holiday card a year. So why wouldn't you want it to be from your home health agency, right? And we can customize those. We can actually put your staff on the holiday cards. Some of them combine their holiday cards with their calendar mail-outs, which is another great thing to do. And then with the traditional Health Matters loyalty program, we put out quarterly newsletters. And so if you add all these things up, that's 5 touches a year for about a nickel per mailer per discharge, right? And that's in addition to everything else that you're already doing. This is branding yourself with that patient and their family members. You can change the quarterly mailings to monthly mailings. It's even more effective. And private duty guys, you should have monthly newsletter program already set up. Same thing with hospice. So, and you also want to brand medical events that occur, and loyal members choose your home health agency because they see you time and again, and they recognize, and it's a differentiating factor in their choice. If they have your agency understood the services that are expected and they go into an acute setting, they're pretty hard to dissuade from using your agency, as opposed to just leaving it up to the medical community to persuade them in whatever direction they want to, either their own home health or preferred home health provider. So, past and current census, why ignore the patients after discharge? Your goal is to ensure your patients choose your agency over and over each time. Remember, nothing beats patient choice in a clinical discharge setting. That's a Medicare reg, right? If they voice a preference, all bets are off. They can't be dissuaded against it, regardless of why they choose it. So with this loyalty program, I want you to do other things. I want you to buy signage and create your own events. Do some event planning once a quarter. Is a good time to put on senior seminars where you're educating, or pastoral breakfasts where you're treating the area religious community, or you name it, discharge planner network group. If you can get medical social working network group, that's a great opportunity. Most urban areas have nursing network groups, but a lot of times you can be the initial instigator of medical social worker network groups. So I want you to do a lot of signage. I want you to reinforce your message with your patients. And once you get all these leads coming in from these events, put them on your loyalty program and keep them. So knowing all that, and you're going to hit a target database a lot easier. So the next thing is prospecting. Patients need to know you before they go into an acute setting or get to a debilitating condition with a chronic condition. So you make a lasting impression by doing those community events. Health screenings, senior fairs. There's a great webinar coming up this season on annual wellness visits. Great opportunity to brand yourself and enter certain populations of seniors into your loyalty program. You want to offer that. You do the bingo. Not a big fan of bingo, but I love the education and safety classes for seniors, right? But if you're already wearing the bingo pants in your community and you don't want to change pants, they keep on with the bingo. It's just not as great a return on investment as some other things you can do. You know, and seriously, how much single-use lotion and and Kleenexes to the elderly need. Church group presentations, great way to brand yourself with the people still living in the home. It's said that 7% of your population in your service area would qualify for a home health opening. In other words, they would be deemed homebound and have a skilled need. It's just that only 3.5% are identified, because they're almost always identified anymore through acute settings or through doctor's visits. Or it's very rare that someone has a debilitating condition that home health could help with that are still out in their home until they get to the point of an acute admissions warranted. What you want to do is you want to start getting back to what we used to do when we were paid per visit, right, before episodic reimbursement, back in the days where we would go out and do cattle call screenings. We need to do more of that. We need to go out into the community and not try to look for homebound patients. That would be hard to do, but put the word out with these seniors, these influencers in our service community, that here's what we can do, and you may know 2 or 3 people who need this service. We'll get in contact with their doctor today, and we'll give them the help they need. That's a great marketing ploy, right? A great marketing strategy. Not enough home health agencies do a good enough job. They just blow up their referral sources in their service community, in the acute settings and in the doctor's settings, to the point where they have marketing fatigue, which means that the referral sources are so fed up with you not bringing anything of value except food that they won't give you the time of day. And that happens all over the country, by the way. What your goal is, you want to make every contact between your agency and the patient prospects in your community an opportunity, right? That's what we want to do. So again, that's where your patient prospects come in to your targeted audience database. Total data management. We guarantee the security and we protect the management of all your data. In other words, we handle loyalty programs for major home health agencies. There's no HIPAA violations, or there's nothing at risk here. If you give us your discharge list, your list is just as secure as when you send in a RAP to Medicare. We have on-site secure data storage. TAG's data management team will correct errors. We remove duplicates. We arrange in variable mailing format, and you can ask for your list. If you have a specialty program that you would like to put out, what better people to mail to than your own discharged patient population? And we have those lists that are now in mailing format for you. And we remove deceased records 4 times a year. We'll run them through and make sure that we're not mailing out to people who are no longer with us. So, the Health Matters cards, holiday cards, all this is customized to your agency, and you can make it look like anything you want it to look like. But we have templated versions, and these are templated versions right here. Happy Holidays, Cassandra. It serves as a wall calendar as well. And health log books, physicians love those. If they're bringing those in as patient vital signs, blood sugars, blood pressures, what have you, then the patient's going to pick it up. It's going to have your contact information and logo all over it. Here's the opening letter, the cover letter. It talks to the patient from your perspective. This is totally customized to what you want the patient to know about your agency, the unique selling points that you want to get across to the patient. And up in the top right-hand corner is that cutaway discount card we were talking about. It's a laminated card that they can take to Walgreens, Walmart, and they get a letter explaining to them. The letter in the middle on the left is all the places that accept their card in their local area, and there's 4 ways to save using their loyalty program card, their Health Matters loyalty program card. So they're going to keep that card. It's going to save them some money. It's going to brand you because they're pulling it out several times during the year. So imagine if your clients had all these things. There's the FAQ flyer, frequently asked questions about home health. And what this does is it serves to negate some of the myths that are in home health. For instance, the services that there's a copay and there's not, or the fact that if you can drive to the doctor's office, you don't qualify for home health. We know that's not true. So all this is an education and contact system where you're going out to the post-discharge current clients and prospects with these membership packages that contain all these items. And then all these items go out into the contact membership. It includes this mailer and mailing fulfillment. In other words, you don't have to worry. This is a hands-off, passive marketing approach. In other words, you're going to spend around a nickel per contact with every client. Over a period of a year, you'll see that your clients, you can touch every one of your clients with a lot of contacts for around $12 to $15 a year per client, well within the regs. And mailing fulfillment is one of the most expensive things that you'll do. Once you get your system put together, bulk mailing is a lot cheaper than individual mailers. So we provide all those mailing fulfillments. So we mail out your contact letter. And here's the cutaway Health Matters loyalty card. Each one has an individual Health Matters ID code. They have an 800 number to help them out. This is a third-party service for us. We don't manage the discount service. These services are guaranteed through our managing partner. So they would have, just like a group plan number would be your indicator of your agency number. And you may want to put on, if you have DME or preferred provider DME, you can put them on your list. If you want to take off all drugstores except 2 or 3 that give you referrals, you can put them on your list. So we can put out on your letter about where they can use their discount card, whatever you need to tell your client base. And then there's the frequently asked questions. This is explaining the card and where it's used. Local pharmacy, you can use it for mail order, prescription. Pointsofcare.com accepts it, and by telephone, it can be an add-in discount. This plan does not affect patients' Medicare or Medicare Part D benefits. In fact, it's actually supplementing their existing benefits by providing actual additional discounts for things that are not covered under Medicare Part D. So, your members receive prescription savings over the program up to 60% off retail costs, mail order savings for their 30, 60, 90-day supplies, and it covers diabetic supplies, neuropathy supplies, whatever they need. Over-the-counter savings programs, durable medical equipment, DME, like we said, the diabetic savings, hearing savings program. All those are in that little card that they're going to keep as a coupon card. And again, seniors love coupons. And then the patient health logbook. The patient loves them. They love to be in charge of their own post-acute episodes. The more responsibility of care you give on to the family members and patients, the more compliant the patient is, the better the outcomes. And we have some specialty programs we'll be going over when we talk about marketing outcomes, and that's the central theme of what CMS and Medicare is driving toward with home health and therapy services. That is, reach the patients, teach the patients, make them become advocates of their own health in the home. We never could do enough patient teaching in one episode, one opening of a 485 to last an entire 60-day episode. We have to continuously teach on every visit and continuously give them the responsibility of self-care. And this is a lead-in to do that. These are the health blogs that will assist them in doing starting their own self-care initiatives. Provide your patients with 3 months or more of health records, including medications, doctor's appointments, immunizations, cholesterol, surgeries and procedures, blood sugars. What it does is not only puts them in charge of their post-acute or chronic condition management in the home and their family members, it also talks from one specialist back to the GP, back to the hospital, wherever they take that log book. It is an amalgamation of different tests, medications, doctor's visits. It's like their complete history and physical in the home. And they're carrying it around with you with your logo and contact information on it. We said before that most seniors get 72 or older get a single birthday card every year. So you need it to be yours. Each one is customized to the patient's name, which is kind of neat, and they'll appreciate it. And here's a holiday card. Some of the most touching things that we get back at TAG, because we're on there in the fine print and with our address information. Every once in a while, we'll get a thank you letter from someone on the loyalty program who has found our address and sends us the thank you letter, and we forward it on to you. But some of them are very touching. Some of these seniors write 2-page letters as thank yous to receiving a birthday card or a holiday card. And you come here to boot camp, we'll show you, we're very proud of them. We'll show you what it means to some seniors and how effective some of our clients have been in attracting business and keeping business. So now we'll cover quarterly mailings of newsletters. Remember, you can mail out every month too. Now, we have 2 different brandings. We have our Health Matters branding, which is once quarterly. But we also have newsletters that you can buy as templates, and all the private duty agencies should be on board with that. It's the most cost-effective, best return on investment money you can make as far as actual branding of services. The Health Matters quarterly newsletter is always compliant with health-related management issues, things seniors need to know in the home. So, and again, it's certain components are customized to your agency, so you can tell them what you need them to know. So, I've been touting it as being the best return on investment of any product that we currently have, and we have some pretty good ones. You guys blow us up sometimes about, you guys are too expensive. Let me tell you something. I'll tell you what's expensive. It's expensive to have someone on the payroll bringing in 6 to 8 referrals a month. That's where you guys are blowing your money. We can solve that problem for actual pennies on the dollar. But you guys, for whatever reason, some of these sales reps out there representing agencies do a better job of selling their boss on the fact that it's so hard out there and you can't make a differentiating factor, and I just can't get referrals because of this reason and that reason. They spend so much time selling their boss on the fact that they need more bonus money, or they need $500 to feed a horde a lunch one day, that they don't have time to sell your services to the market. So, gosh, don't ever get on a coaching call with me and tell me how expensive we are, because I will tell you where you're blowing your money in a skinny minute. You're not training your staff. You're not putting them on a productivity model. You're not giving them the tools that they need to differentiate your agency, and all they're doing is showing up, telling them how much they love their patients and how much you'll love these donuts. You'll never get to be a preferred provider in your service community with that strategy, people. There's a reason why the top 10% of the reps get 50% of the business in every market that we service, because they know what they're doing. And the other 90% of the reps are actually eating more than they're killing out there. And that's where you're blowing your money. So if you want to talk about real return on investment, here it is. If you bring in 2 new referrals per month, that's 24 referrals per year, and your average herd rate is around 3,000, That's the national benchmark now. I think is $2,987. That's $72,000 of new revenue per year, and that is just a really, really low estimate, right? Because honestly, you call me up and get me on a free coaching call with your reps, I can make more than a 2 referral a month difference in your reps. Just getting them off of what they're doing now and putting them on a productivity model and making them stick to it. Now, talk about the minimum of 2 patients referrals per month that your competition is taking away from you, right? So 2 new patients through prospecting, 2 repeat referrals per month. That's 24 repeated. That's another $72,000 in another area of your loyalty program, which is repeat on-service clients. And remember that exercise I told you about. You go to your Medicare Common Working File, you run those numbers, you'll be shocked at how many of your clients are going to your competitors on their 2nd, 3rd, and 4th episodes. And it could have been yours. Very easily could have been yours, or the vast majority of them. So, your new patient revenue plus your repeat referral revenue, that's $144,000, 4 referrals a month. And, you know, I talk to you guys out in the market. That's what some of your marketers are bringing in, right? That's credit that they're getting. This is a static marketing campaign. It is hands off. You don't even touch it. It just does this. It does. We do the work for you. It's just happening. It's a pipeline of business coming in that is not low maintenance. It's no maintenance. So your total annual investments are going to be for 500 census or 500 mailers, about $11,880. Your return on investment is $132,120. These are low return investments. So think about the hundreds or thousands of patients who received your services last year and the patient prospects that you've interacted with. Do you see where the loyalty program, this static, passive, hands-off item that you got working for you 24 hours a day, 7 days a week, can you imagine plugging your numbers in how much return of investment you're going to have? Okay, I couldn't resist preaching a little bit. So I got an email from Marcia in Jocelyn, Missouri, and tells me not to preach so much on my webinars. Eric, you got good information, but I feel like sometimes you're talking down to me or you're fussing at me, and I don't like to be fussed at. Well, Marcia, I don't know what to do because I just know the truth and how to say it in a certain way. But if you want it candy-coated, I will put it in a card that plays music when you open it up. And I'll send you copies of the screenshots, and they'll just play some kind of soft music when you open it up. And look at the facts, right? So here's what I'm going to do today. I'm going to give you an initial shot over the bow to focus your marketers, right? Now, of course, I'll send you Health Matters Loyalty Program samples, and of course, we'll give you every discount. We'll put everybody in our Platinum program, which means you're supposed to have a 5,000 count client base. If you have 50, we'll give you that price for your 50. So we're going to hold to that product model pricing for you and get you started. And what I would suggest you do is do that Common Working File trial. You look at and see. If I'm not telling you the truth, drop the program. If the first quarter you're not growing your business, if you can't contribute 2 of your referrals coming from your loyalty program, drop the program. No one drops this program once they're on it, because what they'll do is they'll look for other ways, other areas. But this thing works, right? So what I'm going to do is, here's the other thing I'm going to give you. This is a great 3-hour seminar. It's an audio seminar, and we have a cheat sheet and all the print collateral from one of Adam's 3-hour half-day seminars. I want your marketers to have this in their hands and play it in the car, because this will keep them focused. This will give them ideas, and this will put them back in the game. This will keep them going in the right direction, thinking about the right things, as opposed to, following their tail around, looking for different contacts to put on a contact sheet. Who cares about your contact sheet? Show me your referral sheet. Show me the admission sheet. What are you bringing in? You know what? If you can bring me 10 referrals a day and go to a matinee, then I'll buy the popcorn, right? It's how effective you are. This will make them more effective. I promise you. Okay? So it's usually $147 just till Monday. And because you're on this webinar, we're sending them out as a kit. You got two. You got the workbook, the transcript book, and the CDs that they can play, even if they can't read. And some of them have trouble in that area. They can play it on their car CD player. It's very valuable. And we'll throw in a 48 proven step book, along with, and when you call in to Rebecca and tell her you want this, tell her you want a sample packet, not just the loyalty program, but give me everything you think I need. Take a look at all of it, because we discontinue items out of our inventory that don't work. We only keep up there things that we have collateral proof that have great return on investment. That's because we're a marketing company. So here it is. Stop losing satisfied clients to the competition. And guys, you don't have to use the Help Matters loyalty program. That's only for people who want to save a buck. If you want to do it yourself, then do it yourself, but you need to do it, right? Because we're letting too many of our discharge patients go back into acute settings, and if the hospital has their own home health, we lose them, because we don't get a second chance. Once they're in an acute setting, how many of you have access to roam the halls anymore at the hospital looking for your prior clients? Trust me on this. Do that common working file study, and you'll be calling me and or Rebecca, and you'll be asking for this loyalty program. So enough said. I want to just put you back on the fact that these will go out and they have a money-back guarantee, those marketing pieces. Right? If you don't like it, box it back up. We'll give you your money back. And keep the 48 proven steps. That's a good read. Your marketers don't read enough about what they're doing. And this is the #1 bestseller in all of home care marketing. It's been around a while. And of course, we have newer publications too, if you'd like to see it. But Magnetic Marketing for Home Care. You need the slides, transcription, and the CDs. It's a great buy. Give it to them for Christmas. And if the referrals don't increase, get rid of them by Valentine's. That's my motto. Guys, I love speaking with you. Give me a call. Schedule a coaching call. Call right now, 1-866-232-6477. Talk to Rebecca. I'm going to read some questions, and the best question out that I read from the webinars that come in, because you guys don't write enough questions, I'm going to give a free marketing kit to. Magnetic marketing kit's going out to someone in about 2 minutes when I pick out the question that I like the best, and we're going to send you out a free one. However, I want you guys to contact us. Just give us a call. Everything we do, we hold costs to a basic minimum, and we'll guarantee a 5-time return on investment. So just keep that in mind. You can always schedule a call online at www.homecarecoachingcall.com. That's my actual email address. You guys can email me questions. I answer all my emails. Okay, so here's some questions. Hey, Richard. I was just seeing Richard a couple weeks ago in Orlando. He's just saying hi. Hey, Richard. Felicia. Now, Felicia, I saw you in San Antonio. Yes, this is the home health, and it's all inclusive. The birthday cards, everything. It's done here. We do it in-house. It's done on our $500,000 HP presses, so it's very good quality work, and you guys are mailed sample packets. Every time there's a mailer, you guys are put in as seeds, so your agency will know when certain elements are going out into the community, and you can start marketing that to everyone. Oh, well, I might be hand-delivering one of these magnetic marketing. My wife wrote in, and she wanted to know if I have any bingo gobbers for sale. Ha ha, that's very funny. Omar, he wants to know about other things that I mentioned, other areas that we can do, make a difference in marketing budgets and time. I'm telling you again, guys, the most cost-effective way you can do it is make sure your marketing staff's well-trained, and we can do that for you. And that's very cost-effective. Talk to Reba when you call her. You can get a sales coach 1 hour for 4 weeks for $247 a month. And I guarantee you'll see some change once they accept the responsibility of bringing in new business and retaining old business. Here's a private, there's a good suggestion from Dale about mimicking other loyalty programs that are effective in your area. Yes, by all means. You go people outside the home care agency, see what their best return on investment is, and we'll mimic it, and we'll make it happen for you guys. Remember, we're a one-stop shop. We do it all in-house. When I say come to Tag Team for a boot camp or a visit and meet the Tag Team, I'm serious. There's some master printers here, designers. Adam Bishop has got the best people in the business working here. He gleans through. He has a lot of contact, and he brings the best and brightest, and it's called the Tag Team. We'd love to host you guys for a lunch or something. Are the holiday cards generic? Yeah, they're for Kwanzaa, Christmas, and Hanukkah. So it just says Happy Holidays. And Mimi wants a copy of the slides. Mimi, I'll give you that. And Carlene, you're asking a question about chronic care models. Give me a call. Schedule a coaching call at homecarecoachingcall.com or call Reba right now, 1-866-232-6477. Carlene would, because you're going to be blown away about the disease-specific marketing and patient care concept models that we have and we could share with you. And we don't say we can do it all for you so your clinicians will eat it up like manna from heaven. All we're saying is we can do 90% of it. We can give you a working model for some of these disease-specific programs that'll make a difference. And Karen, same question. Yeah, they are generic, and you can use them for all the winter holidays. And yes, Kathy, you can buy other components. You don't have to buy the entire package. You can just get logbooks, flyer cards, or the prescription cards. We have different levels of the loyalty program. If you already are doing some outreach yourself in newsletters and other things, and we can be an adjunct service to that. Yes, you can call us up, and we'll tell you how to use the program, how to put it out, how to get your best return on investment. And Esther, with your question, I suggest you call Reba now before the lines get lit up. And sometimes you go to Cindy, which she has the best set of legs in home care sales, or Brian, and his legs aren't bad either. One of them will take Reba's overflow for you. But that's a question that you just need to call in and talk to them. and you can get samples online. Call in, again, talk to Rebecca. She'll give you a code. You can go to myhomecaresalescoach.com and get free samples of a lot of the disease-specific stuff. For letters, it's homecarenewsletters.com, www.homecarenewsletters.com, and you can get a free template. Just call in, get the code from Rebecca, and you can get a free sample of that. Just download it as a template online. Carlene, you do a lot of Medicaid. These patient education newsletters, great way to brand yourself with not only the Medicaid clients and their families, but also discharge planners. You want to put them on the mailing list. And remember, 1 in 5 Medicaid patients are dual eligible, so you're going to get some added benefit. Serena, could you help us identify the doctors that do the most home health referrals? Yes, we can. Our data guys, and we team up with Health Market Science and other, Richard Chesney's group, Health Market Resources. We have the list of where the referrals are coming from in most major markets. So when we go in and we do a SWOT analysis locally on contract, we set up productivity models for home care reps that really make a difference, because we set them up with the top 10 referring accounts in each referral sector that we target. So give us a call. And Miles is saying my number's not a working number. 1-866-232-6477. So that's a toll-free number. Just dial a 1 in front of it if you're having trouble. So I'm going to put you guys back out into the general. Well, here's some more great questions. Judah, is there a brochure explaining Medicare and Medicaid benefits to patients? Yes. But you know what? You go to Medicare.gov, and they have great downloadable flyers that you should be sending out. And one of the great flyers is the difference between direct Medicare and Advantage care plans. There's a lot of great information just on Medicare.gov, but we have those type of brochures and everything too. And Shane, yeah, Shane, I'm not beating up on home care reps. I'm just beating up on bad home care reps. I love good home care reps. In fact, I used to manage some good home care reps, and I miss it. I do on-sites every once in a while, and I still come in contact with good home care reps. I'm just at the point of telling agencies 2 things. First, you need to work smarter. You need to cut down your overhead. And everyone is not contributing toward the success of your agency. So you take a collateral view, take personalities or whatever out of the equation. Look who is out there eating more than they're killing. You're only making a buck on your clinical staff. Medicare or any other payer source is not paying you to have a marketer or a QA nurse or a billing clerk or whatever. All those people you choose to have, and you choose to have them for a reason. They better be pulling their weight. They better be taking at least 2 or 3 of these hardworking clinicians, aides, and therapists and pulling them in their wagon. Otherwise, get rid of them, right? And I'm sorry if you hired your brother-in-law or your sister's cousin or whatever, and you have that emotional pick, then you're going to have to just live with it. What I like to do is get these young, bright kids that don't know anything about home care, but are willing to work for about $30,000 a year and go make their mark in the world and put them to work efficiently. That's a great working model if you have a problem with reps. So I think that Shauna Lucan has won the magnetic marketing kit. So Shauna Lucan, I need you to call in to 1-866-232-6477. She sent in something that is pretty good. It wasn't exactly a question. She started preaching too a little bit on her questions. So, but agency thinks it's the lack of education not on our referral sources end, but on our marketers end. And I agree with that. It's a very powerful statement what you wrote here, Shonda Lukin. Call in 1-866-232-6477. You're getting a free magnetic marketing kit and the 48 proven steps. Guys, I'm off again, but do call us, set up a coaching call, and I love to hear from you guys. We hear from a couple hundred different agencies a week on average, so honestly, we just share the love right back to you. You guys are doing a great job out there with clinical services, and remember, we're still the most cost-effective way Medicare spends a managed care buck. I don't care what anybody says. We have the numbers to prove it. We just need to get our message out there and work smarter. I hope everyone has a great week, and I enjoyed spending time with you, and thank you to everyone for attending today's webinar. I'm going to leave my contact information up there for another 5 minutes or so. But enjoy your day and go out there and make something happen. Thank you.